All right, so take a look at this rhythm. You can pause the video if you want and see if you can figure out what it is. Or you can just sit here while I keep talking and try to figure it out while I drone on and on. But anyway, hopefully you took a second just to try to see if you can figure it out on your own. And then we'll go forward. So the answer to what it is it's ventricular fibrillation. And if you'll notice, as we go through, there's really not any distinct waveforms, right? If we start with like asystole, it's just a straight line. This just looks like a jagged wavy line that just kind of goes. There's no P waves. There's really no QRSs. You might think like, well, this kind of looks like a QRS, but not really, right? There's kind of wavy lines. And the name tells you exactly what's happening. The heart isn't beating, really. It is, but it isn't. Essentially, fibrillation, if you haven't heard that term before, it basically means like quivering, to fibrillate, like quivering or kind of shaking. So if you can see me like on the screen, basically the ventricle, instead of giving that nice big, I always do this to be the heart, like here's our here's our atria, here's our ventricle. Instead of doing this, the ventricle, instead of giving that nice big pump, is just kind of like quivering, right? So it's not synced up. It's not giving like nice big contractions, just kind of like shaking and pulsing, which obviously means that it's not pumping blood. So effectively, the ventricles are becoming desynced there, and so they're quivering instead of giving those contractions. And those contractions, again, is a QRS complex. Again, I'm going to repeat a lot of stuff because I'm trying to keep it basic and I'm trying to make sure everybody learns the most important stuff. And again, repetition is how you learn stuff. I've said that a couple times in the other videos now, and I keep saying it because someone should learn that repetition is how you learn stuff. Um, so in this situation, there's no actual pulse because again, the ventricle isn't beating. It's just quivering, but there is still electrical activity in the heart, right? Because if there wasn't electrical activity in the heart, then we wouldn't see anything. We'd see asystole, right? So this is also a life-threatening rhythm because again, there's no pulse. If they have this, they are either passed out or they are about to pass out. So it's not necessarily as bad as asystole, but it's still not good. So what do we do? Well, just like before, it's a life-threatening rhythm. So we initiate CPR and we initiate the emergency response system. Now, one thing that's different than asystole is now we get into defibrillation. So I'm going to go over defibrillating just briefly, as well as a couple other things. So defibrillation is when we give an electrical shock to basically resync the heart rhythm, right? In other words, we're giving a shock to kind of like reset it. It's almost like unplugging your router and plugging it back in, or resetting your computer, restarting your computer for an update or something like that. You're sending a shock that's basically trying to tell the heart to, hey, get back in sync, right? The heart has electrical rhythm. It has an electrical impulse, but it's not connected and it's not synced up. So by basically hard stopping it, hard resetting it, the hope is that once that reset's complete, that those electrical rhythms in the heart, they'll resync, and then it'll be a normal rhythm, or at least a better rhythm than ventricular fibrillation or whatever rhythm you're trying to get rid of. So when we do defibrillation, oftentimes the thing that's going to decide it is an automatic external defibrillator. Might also be a physician giving you orders of when to shock. So the rule with the paddles, so the way you give the shock is there are paddles. They're either going to be placed on the chest, or somebody's going to have them in their hands, and they're going to be responsible for, holding it to the person's chest, giving them a shock. There's this divide, I guess I don't know what you call it, but basically just like a little saying that you again hopefully learned when you took your BLS CPR classes. I'm clear, you're clear, we're all clear. And that's when you give a shock, when you initiate a defibrillation. You say this, but you say it because you're also making sure it's true. You check and say, okay, I'm clear. I'm not touching the patient, except for maybe the person that's holding the paddles. But again, typically you'll have like an AED, so the paddles will be attached to the patient. I'm clear. So I'm not touching the patient or anything touching the patient. So no, not the bed. I'm not leaning up against the bed or the bed rail or anything. You're clear. So everybody I can see, nobody else is touching it. Like, hey, everybody take a second. Make sure you're not touching the bed. Make sure you're not touching the patient. we're all clear. Make sure, like, look around, make sure every single person is clear. The reason this is so important, again, probably most of y'all have learned this, but just in case you haven't, if you are touching the patient and you deliver a shock, well, it's electricity, and electricity goes wherever it can. And you're just as good a conductor of electricity as the patient is. So that person doesn't have a good heart rhythm. So it's going to try to reset their heart. You, hopefully, if you're in the process of giving somebody, CPR and stuff, your heart might be racing a little bit, but it should be a normal rhythm. Well, when you get shocked, it's probably not going to be normal anymore. It could actually put you into asystole or another like arrhythmia. And so that means that now, in addition to the patient who's laying in the bed with a life-threatening arrhythmia, you now also are probably experiencing a life-threatening arrhythmia. So definitely make sure that you're clear. Make sure everybody else is clear. Don't shock anybody else. A couple other things to note, again, with these AEDs, with the pads and everything, make sure everybody's clear. Don't give a shock unless it is advised. So don't do it unless you were told to do it by the AED or by an emergency medicine physician that's present at the bedside. Or if you are an emergency medicine physician, then you're the one giving the orders to do it. I don't know why you'd be watching this video, but hey, welcome if you are. So make sure everybody's clear. Another thing to note is that if you are giving shocks, you got to be careful. If you have somebody like me, not to get too personal, but I got a lot of chest hair and it's coarse and I don't shave. So if somebody has a lot of chest hair, you may have to shave them because again, the pads won't connect well to the skin and it won't deliver an effective shock. Similarly, if the person is wet, if they were in a pool or something, try them off as best you can, or at least try off the area you're attaching the pads to. If they have any kind of medication patches, remove those. Like if they have like medication patches that are left on their body, try to remove those. Be aware if they have a pacemaker, because the defibrillation can be harmful to the pacemakers. It can like do a lot of bad stuff, but also those pacemakers often have a defibrillator inside of them as well. And so actually, if you're trying to defibrillate or pace somebody, you would change the pacer settings, not use an AED. So those are all there's a lot more I could say, but just basic stuff. And again, if you're in BLS, you learned all that and you would have learned a lot more. If you take ALS classes or something, you'll learn even more, but that's just the basics. For ventricular fibrillation, the meds we want to give. So again, epinephrine, we're trying to get the heart to pump effectively. The other things that we might give are lidocaine and amiodarone. Now, the classifications, lidocaine is kind of like a local anesthetic. It helps dull nerve sensations. Amiodarone is classified as an antiarrhythmic. In both cases, though, what they're doing basically with the lidocaine or the amiodarone, and again, this is just very general. They have different mechanisms of action, but generally speaking, they both kind of work to um, like deaden. I don't want to say deaden because that's kind of bad indications, but like deaden or nullify or kind of like slow down like nerve impulses and nerve signals. So the idea is hopefully that it'll kind of help prevent whatever desync that's occurring in the heart from happening. It'll kind of help inhibit the nerve signals that are maybe causing this. So yeah, if you aren't familiar with those, I would say look for your drug guide and just refamiliarize yourself with them. You probably learned about them in pharmacology, but yeah, refamiliarize yourself with those medications. If you're not, but those are what's commonly prescribed with ventricular fibrillation. Another procedure that might be done is what's called catheter ablation. So catheter ablation is a type of surgery. It's usually done laparoscopically, going through like the femoral artery or another artery, going up with a catheter that's guided into the heart and using extreme heat or cold to actually create scars on the heart tissue to help block or stop electrical impulses in like the problem area. So again, it's a problem of the electrical signals in the heart not being synced up correctly. So this is the idea is that it's going to we can identify, okay, well, where in the heart is this problem originating? Where are the signals getting desynced? And then creating scar tissue or killing like tissue to help block or inhibit those electrical impulses, right? Catheter ablation is a procedure that's going to come up in the other arrhythmias. So if you watch some of the other videos, I won't go as much into detail. I'm going to cover these, as they come up. I'll spend a little bit more time going through them. Not necessarily going to cover them every single time they come up. I know I said repetition is, important for learning, but I figure, hey, you can just rewatch the video, right? And get the same info rather than me saying it another time or two. So yeah, so that's it for ventricular fibrillation. So this will be what we're going over next. So yeah, you can pull up the next video to watch this one.